What are the solutions to electronic health record implementation challenges for Nigeria hospitals? Not long ago, the health sector was really getting it as a result of digital revolution using electronic health records. And these are used to replace manual records and paper records in hospitals. These improvements and innovations comes with certain challenges, and let us talk about them. There are five that we are going to talk about in this video. Lack of electricity, lack of internet, lack of connectivity, lack of training, and lack of funding. When we talk in terms of lack of electricity, what do we mean by that? Nigeria has one of the lowest reliable electricity in the world. Without reliable electricity, it is very difficult to access electronic medical records, and this is causing a lot of problems for electronic health records implementation in Nigeria. Another one is lack of internet. The internet speed in Nigeria is very low. It's one of the lowest among countries. So even when you have the connection, it is expensive, it is irregular, and some hospitals cannot give enough internet to their staff, and this is causing problem for electronic health record implementation. When you want to have an in-house connectivity like within your premises, you still go to have certain difficulties, and one of them is that you need to get a network administrator, and this is very scarce in Nigeria. Even among sectors that are paying a lot of money for network administrators, some of them are still leaving the country because they are looking for better pay. So when you have a good network administrator and this thing is installed locally for you, you need to be monitoring the system, because sometimes the cable may be damaged, someone may disconnect the cable or even switch it off. And even when this system that was good, working for you perfectly, can run into problem along the line, especially when your database grow, the performance can get slowed down, and there may be some ports that will malfunction and there may be overload, and this can trigger problems for your electronic health record. So another difficulties in using electronic health records in Nigeria is lack of staff training. If you buy an electronic health record that is difficult to train, you need to budget a lot of time, allocate a lot of time for your staff to familiarize with the software. And you see, some staff too have bad experience with electronic health record. They will not want to cooperate, because if they have negative experience of a staff losing their job, which is quite unpleasant, you see, they may not cooperate. There may be political discourse within your hospital that can upset their positions, and this can make them not to cooperate. In some electronic health record, especially the foreign one and some Nigerian ones, are highly costly. You pay monthly subscriptions for them. Apart from the internet, you need something that is not so expensive and that you can easily purchase with limited investment, and that's why you can go for Agimed, whereby you can spread your payment for the setup over some months. You pay instrumentally, including your renewal. So that's another difficulties. Fundings. Health sectors is not even getting external fundings from investors, and so some of these hospitals, they are struggling financially. Let's go to the solution of electricity. You need an electronic health record that you can use different kinds of devices. If light goes off on one, you can use another one. Although desktops and laptops may be much more better, but sometimes if you have phones too, you can use it. Instead, you can charge it with low power, and when you put on your light for the meantime, you charge several gadgets and you can use them. So if you are using an electronic record that is only stagnated to desktop or laptop, it may not work for you. So you need to have low electricity consuming devices for you to actually solve this problem of electricity. even with the little generator you put on. Lack of internet, you need to have many internet service providers that your staff can switch to and you yourself in the facility. Because in Nigeria now we have a lot of internet service providers apart from MTN, Glo and all the likes, and so you can have multiple SIMs in your phones and your computer, your wireless. Ensure you use anyone, even when it's not going, connect to another one, and that you are able to solve the problem of lack of internet. So for the connectivity, if you are using in-house connectivity, you need to always get in contact with your network administrator. Apart from the EHR vendor, you need to familiarize with your network administrator, because he's the one that will help you to do the troubleshooting. And if you don't want to go through the problems, because it will cost you additional hardware and software, just get a deployment that uses cloud. So you need to have a training plan whereby it will accommodate those that are on shift. Ensure all of them are trained, and get an EHR that is easy to navigate, that one of your staff can actually take another staff that is being hired through, because the way at which hospitals are losing their staff to brain drain and to several other challenges is high. So you need an electronic record that is easy to learn, that someone can even learn by themselves. To solve the problem of funding, have a budget. Get to know how much will it cost to do training, to get internet to use for your facility, how much will it cost to do renewal, can you pay subscription fee for dis software, does it meet your needs even with the minimal cost. So if you use Ajimed electronic medical record, which is user friendly and is a modern electronic record, you get all dis things and you can access it across phones, and you can use tablets and personal computers on it, and it helps you to manage your outpatient, your inpatient. You have different user, different roles, your HMO managers will work on, your pharmacists, all of them, even the finance officer, and there is safety encryption with digital signature, and there is firewall. It will, you are able to manage your stocks, pharmacy inventory, surgery management, procedure, laboratory, patient portal, different inpatient, outpatient vitals, affordable pricing. You see, there are some electronic health record that you cannot use to manage your HMO, but not with Ajimed. You are able to manage any kind of patient you have. You don't have to click a lot. There are different suggestions and templates you can use. So qualitative electronic health record that is suitable for different practices, whether small practice or large practice. You have SMS email notifications, you have drug charting and friendly pricing, including pay in parts and all the likes. So thanks for lis ten ing.